Our next paper comes from Erin Stone, who practices general internal medicine in LA, California, and has served on the faculty of both Wright State University School of Medicine and the UCLA School of Medicine. The paper is entitled Examining Elijah's Trauma-Induced Depression, Implications for Addressing Mental Illness in 2025.
Well, thank you, Goran. It's a real privilege and pleasure to be here. Before we talk about Eliyahu, let's look at determinants of mental health. So there are a number of things that can affect mental health, just like there are a number of things that can affect physical health. So I'll just mention 4 of them. There are a bunch more, but these 4, I think, are some of the most common. So there are genetic factors. So depression, schizophrenia, those things run in families. So if you've got a family with that kind of history, you're going to have a greater chance of having those mental illnesses. And then there are physical illnesses as well. So Carmen brought this up a little bit, the mind-body connection. So if you're physically ill, you're going to have a greater chance of having mental illness. Let me just give you 3 examples of those. So if you have cancer, your chance of getting depression within the first year is 20%. If you've had a stroke, your chance of getting depression in the first year is 38%. And if you've had an acute heart attack, your prevalence of depression measured a few days to a few weeks later is 29%. So these are pretty high percentages. We see this all the time in medical care. The third one is social determinants for health. So those of us who practice medicine, we're practicing in sort of the medical world, trying to decrease morbidity and mortality. There's another whole world out there of non-medical factors that affect a person's overall health and health outcomes, and these are called social determinants for health. And these can be pretty deadly, actually. So it's been looked at, and researchers have looked at this, and at least in America, 176,000 deaths occur from racial segregation, 133,000 deaths occur from individual level poverty, and 119,000 deaths occur from income inequality. So if social determinants of health don't kill you, they can also maim you. And so you can certainly get mental health from these adverse social determinants of health. And then the 4th one is trauma, the subject of our conversations over the next few days. So PTSD, as was just mentioned, anxiety and depression, those are the big 3 for trauma. Okay, so let's talk about Eliyahu. So trauma, at least from a psychological perspective, is the experiencing or witnessing of events in which there's actual or threatened death, serious injury, or violence. So when I take a look at Elijah's story, I see 2, probably 3 actually, traumatic events. So the first one is on Mount Carmel. So if you're like me, you've heard bunches of sermons on Mount Carmel, and they're always usually positive. You know, the Lord and Elijah are up there, and they come out on top as far as their their adversaries go. But looking at what was going on Mount Carmel, Elijah probably felt pretty threatened by violence. You've got the evil king that was his archenemy. You've got the prophets of Baal, and they are cutting themselves. They're probably just ready to cut him as well. And then you have the Israelites who are under the influence of an evil king and an evil queen. And so nobody is on his side except for God. So he might have felt threatened by violence on Mount Carmel. And then there's the death of the prophets. So after this is all over, they go down to the brook, and either he kills them or he tells some other people to kill them. These are hundreds of prophets. And so he's witnessing this, if not participating in it. So that's another traumatic event. And then there's Jezebel's threat. So the LXX has a little more poignant story on this than the Hebrew version. So then Jezebel sent a messenger to Elijah saying, "If you are Elijah and I am Jezebel, so may the gods do to me, and more so also, if I do not make your life as one of them, meaning the dead prophets, by this time tomorrow. So now Elijah is threatened with death. So three traumatic events. So what does he do? Well, he flees to Beersheba. He leaves the servant there, travels on another day, and he says, he asks that he might die, saying, "It is enough now, O Lord. Take away my life, for I am no better than my fathers." He falls asleep. An angel or a messenger comes, wakes him up, says, "Eat and drink, arise and eat." So he eats bread and water, goes back to sleep. This messenger or angel comes a second time, says, "Arise and eat, your journey is too great for you." He arises and eats again, bread and water. Then he travels 40 days to Mount Horeb. He lodges in a cave there, and he has a couple of pretty similar conversations with the Lord. So the Lord comes along and says, "What are you doing here, Elijah?" And Elijah responds by detailing the events from his perspective that have occurred recently. And so this happens twice, and then the Lord eventually sends him on his way, and he gives them 3 tests to do. Okay, so Elijah was traumatized. Did he have mental illness? So we have to be a little bit careful in ascribing mental illness to people in the past for a couple of reasons. One is we may not have complete information, and the second is there are different social contexts then and now. So what may be sort of normal behavior back then, we may consider abnormal behavior today, so we've got to be a little bit careful. But with those caveats in our minds, Elijah clearly has symptoms of depression by modern psychiatric criteria. So a patient comes in, we think they might have depression, we look for 9 criteria. So these are both physical and psychological criteria, and we'll see how many of these they have. So when I look at the Elijah story, he's got a depressed mood, he's got feelings of worthlessness, or at least low worth, and he's got thoughts of death. So he's got 3. He's sleeping a lot at the beginning of the story, so he may have hypersomnia. He's not eating very well. This messenger or angel is telling him to eat, so he may have anorexia. He's got diminished interest in things except for, getting out of the traumatic experiences. He may have a loss of energy. And when we look at diagnosing depressive disorder, patients need to have these symptoms for at least 2 weeks. And so when I look at him running for 40 days, I don't think that his psychological state is any different than it was when he was going through this trauma. So I'm thinking he's got at least 2 weeks of these symptoms. So in my mind, he at least has minor trauma, minor depression, which is at least 3 of the symptoms. Iwanski and Plutz thinks that he has major traumas. One of them is a psychologist, the other is a theologian. They wrote a paper just published a few months ago on this topic. And then there were 7 psychiatrists from Portugal who also, again, earlier this year, had their opinion on this. And so they think he has reactive depression. So reactive depression is a term we don't use much anymore, but it basically means that somebody has some major experience in their life, like trauma, and they're reacting to that by being depressed. Okay, so what do commentaries say on the Elijah story? Well, I reviewed about 36 commentaries, and several of them have charged Elijah with faithlessness, cowardice, and selfishness. When they look at the Mount Horeb interaction between Elijah and the Lord, what are you doing here, Elijah? Many commentators say that this was a question of rebuke. In other words, what are you doing here, Elijah? So it's basically a rebuke from the Lord. So overall, these commentators have a negative view of Elijah because they perceive that his traits of faithlessness, cowardice, and selfishness, and their interpretations of the Lord question as a rebuke. So let's look at stigma and mental illness. So stigma is any long-lasting individual or group trait that is considered deviant and may evoke negative or punitive responses from others. So we see this all the time in modern society. Race, ethnicity, gender, sexual orientation, immigrant status, religion, all of those things can be stigmatized in our current society. So these commentators then are basically stigmatizing Elijah's mental illness. They have a negative response and believe that the Lord has a punitive response to Elijah's perceived traits of faithlessness, cowardice, and selfishness. Okay, so not only can commentators stigmatize mental illness, but religious communities can stigmatize mental illness as well. So in a book chapter entitled Stigma and Mental Illness in the Abrahamic Religious Traditions, Matheson and colleagues reviewed several results from studies on mental illness stigma and religious communities and conclude that common religious beliefs, particularly among the Abrahamic traditions, indicate that the main causes of mental illness are moral weakness, sin, and unfaithfulness with religious practices such as praying, reading scripture, or worshiping. So similar to the commentators that we just mentioned, these religious communities are also stigmatizing mental illnesses as having a negative or punitive response to their perception of moral weakness, sin, and unfaithfulness with religious practices. Okay, so let's look at a subset of these religious communities, the fundamentalists. So there have been a few studies, not many, but a few studies looking at stigmatization and mental illness from a fundamentalist perspective. And there are significant issues with some of these studies. Some of the survey instruments were probably not validity and reliability tested. A couple of the studies looked at schizophrenia rather than depression. But all of them actually point in the same direction as far as the results are. That is, religious fundamentalism as a significant predictor of stigmatization of people with mental illness. Okay, there are also some non-stigmatizing commentators from that we read in the Elijah story. So F.F. Bruce notes that not unnaturally, Elijah was afraid and ran for his life, thus gaining the undeserved scorn of insensitive commentators. It was not pale cowardice, but cold realism that prompted his withdrawal. And in a sermon outline, Charles Spurgeon says that the Lord showed Elijah's compassion and support, and he and other commentators mentioned that the Lord's question to Elijah was not one of rebuke or chastisement, but rather an invitation for Elijah to express his thoughts and feelings about his traumatic events. Okay, so let's look at some other aspect of religion, of Elijah's journey into Mount Horeb. So he was surrounded by some physical environments, had the Lord's instruction, and so we can look at each of these and see if they either hindered or helped his depression. So the details are in the paper, but I'll just summarize. Exercise, sleep, Mediterranean diet. I couldn't find any studies on water and bread for treatment for depression, but sun exposure, being in nature, a non-noisy environment like the still small voice, and having purpose in life appeared to be beneficial for depression, as far as treatment of depression. Being alone and not being in a community, as was just mentioned, is definitely a liability as far as depression is concerned. Okay, so in conclusion, Elijah sustained significant trauma during his Mount Carmel experience. He had depressive symptoms and very likely had some sort of depressive disorder, either minor, major, or reactive. Commentators have stigmatized Elijah's mental illness and believe that the Lord showed him compassion and support. When I look at this story, I am on the side of the latter group, that the Lord actually showed them compassion and support rather than stigmatizing his mental illness. So the challenge with us, some of the Adventists, is that, well, we are part of the Abrahamic tradition, so we have a risk to stigmatize mental illness. And we have a tendency to fundamentalism, right? We've got these fundamentalist leanings, so now we have even more risk to stigmatize mental illness. And so we've got to be really careful that as we approach people with mental illness, whether it's trauma-induced or not trauma-induced, that we support them with compassion, as the Lord did with Elijah, rather than with harshness, rebuke, or chastisement. Lastly, those with depression, while much of the research evidence is not very robust, simple, inexpensive, and low side effect interventions can help these folks treat their depression.